Hi, I'm Dr. Brian Castellan with Brighton Foot and Ankle, and today we're with Ryan Mertz, one of our favorite physical therapists in the areas. And we wanted to ask him about some of our pathology and some things that we send to him to help us out with and get our patients feeling better and back into what they want to do. So Ryan, one of the first things that we wanted to talk about is joint pain and arthritis. And if I send someone to you for like ankle joint pain, what are some of the things that you're going to do for them?
Sure. So typically with ankle joint pain, understanding what the x-rays show and that there is arthritis is important. But one of the first things that we're going to do is try to help people understand that the degree of arthritis doesn't always mean the degree of pain. So sometimes as a physical therapist, I'm looking at how well their ankle moves to begin with, how flexible their Achilles is, their different ranges of motion, their balance, their strength throughout the rest of their body, and all of that impacts ankle pain and arthritis. So I usually try to start off with like a very hopeful message that while you might have arthritis, there's plenty of things that we're able to do to help reduce what you're feeling with that arthritis. So usually where we start, think modalities, things to help reduce pain and discomfort. Massage is a good place to start, help loosen up the calf muscles. Heat and ice can be really beneficial for people with arthritis-related pain. I do dry needling and I do scraping and cupping as well, which all can help just reduce the tissue compression in the ankle and the surrounding muscles. Because when we think about it, arthritis is a joint compression issue. We want to try to give a little bit more space in that joint to reduce the compression and reduce the pain. And all those things go into helping reduce pain levels. On top of that, typically we talk with the patient and say, what are your habits? What do you like to do? Do you like to walk? Do you like to play pickleball? Do you, have you played soccer for 20 years and all these things are contributing to your pain? How can we modify those in the short term to help reduce your pain levels? Some people are more open to that than others, but we try to think about ways to reduce the triggering activities to help reduce their short-term pain, with the assumption that we'll get back to doing those things down the road once things are feeling less painful. We like to work on balance, we like to work on strength. Those are the big things that we work on. We might look at how people move and squat and do their functional activities, see if there's a better way of going about doing that and put less stress on the joint overall over the course of time.
Yeah, and I think one of the things that we were just talking about before we started this video too is not just x-rays. And if I say you have stage 3 or stage 4 arthritis, that doesn't mean that you're at end stage level of pain. So even in a bad arthritic joint, if we get it moving more, if we support those soft tissues surrounding it, we might not have to do as much surgically, or we can avoid different things. And we can't just read the MRI and say, oh, you've got a grade such and such calf strain, this is where you have to be. We have to support those other structures and take everyone individually.
Exactly. And that's a big part of the physical therapy process, is trying to meet everybody where they're at so that myself as the PT and the patient are working together to come up with a plan, as opposed to just, doc said I had bad arthritis and I'm just trying to wait it out until I can have a joint replaced or a surgery or something along those lines. It's, no, what can we do for you in the short term to help get you moving back in the right direction?
And then how does some of this change? Let's say we are looking at an MRI and we're just going to pick out the Achilles tendon as a problematic spot. And let's say you have a severe strain to the Achilles tendon with some inflammation in that Achilles tendon. What are some of the modalities that you're going to do for that? And I know you kind of just talked about bones, so maybe how does some of this stuff different for a tendon?
Sure. So with an Achilles tendinopathy or tendonitis or a strain, for the first couple days, I think ice is recommended. You want to try to control the swelling as best you can. But after that, we know heat brings blood flow in and it helps get tissues healing faster. So kind of a quick transition to using heat following a day or two of using ice. Using the dry needling helps quite a bit. It helps reduce muscle tone and tension in the calf proximal to the Achilles, which can be pretty beneficial for people. Light, gentle massage can be well received also. Those are probably the biggest ones that I would use in the day-to-day clinic. And assuming an Achilles strain or a calf tear might come from a higher level activity, the rehab would be different as well. If people have higher goals to get back to, running, jumping, planting, pivoting, as opposed to just an arthritic condition where people are probably more so likely to get back to low impact activity and things that aren't very strenuous. We've got to bridge that gap as a physical therapist to say, all right, well, right now you can't walk without a limp, but we need to get you back to playing soccer, playing basketball, whatever it might be, and we got to kind of go stepwise to each of those activities and pass through benchmarks to show that we're safe doing it and we're not progressing too quickly, which would increase our risk for a re-tear or a setback.
Yeah.
Along those lines.
So I guess in our previous video too, we talked about your experience in Major League Baseball and how you traveled with teams for over a decade. Well, how does it compare dealing with those high-level athletes or today your high school level athletes that are waiting to be drafted by certain teams and stuff like that too? How do those demands, those patients change from maybe someone who's fresh into retirement and looking to pick up pickleball or bike riding and keep their new activities as they're entering into that different stage of their life as well too? How do those two different groups of patients change?
Yeah, it's a great question. I think at the base level, I think they're very similar. We're dealing with people here, and everybody has their own goals and ambitions and their own starting point. So you've got to get to know the individual sitting across the table from you, and I think that's really important. At the same time, the physical demand levels and the mentality of those two populations might be very different, where someone easing into retirement might be more focused on doing a daily walk with their neighbors or picking up their grandkids, or just maybe they're cooking more and standing in the kitchen more, something along those lines, less strenuous activity. Where some of my high school athletes or collegiate athletes are looking to throw a baseball 95 miles an hour or dunk a basketball. We've got to make a specific program for each of these people to get to doing the goals that they want to be able to do. I think a lot of people are sometimes fearful about physical therapy, especially those patients who are older who haven't had physical therapy before. They're worried that we're going to push them so hard like they are these high school and collegiate athletes, and nothing could be further from the truth. We're just trying to see where this person's at and see where they want to go and take small steps to get to where they want to go, as opposed to thinking everybody needs to do these crazy exercises or really physically demanding, taxing activity. So there's that, and then the mentality of it all. I think some of the younger athletes, they're really willing to push their bodies through pain and put themselves in maybe some not great spots, and that's why there's all these different injury epidemics that are happening right now. Whereas someone who's old like you and I, we're less willing to take those risks at this point, and we just want to feel good. We want to live our lives and we want to feel good, and we might need a little bit of a push to get into some of this activity again. So the mentality between the two populations is different, and they're both fun and present their own challenges to work with.
Yeah. Well, excellent. Well, it sounds like, again, we got to tailor the program to the person. We got to go after their area of pain and look to relieve it by not only addressing that structure, but the structures around. So, all right. Well, thank you for your tips and advice on this.
You're welcome.